Hello, everyone. My name is Andrew Rosbiank. I'm the Director of Admission for the School of Pharmacy at Massachusetts College of Pharmacy and Health Sciences. Thanks for joining us today. We want to talk a little bit about why now is the time to pursue a pharmacy degree. As demand for pharmacists rise with no end in sight, the COVID-19 pandemic has really changed healthcare as we see it. Through emerging trends, the pandemic, and pharmacy as we know it will never be the same. Going forward in a pandemic or bioterrorism, pharmacists will be key to prevention and distribution of drugs and medications, as well as immunizations. Today, I'm joined by John Finicos, who has direct experience on what the future of pharmacy looks like. John, it's great to have you. Would you mind introducing yourself?
Yeah, sure. My name is John Finicos. I currently serve as the Director of Pharmacy here at Brigham and Women's Hospital, so I am a pharmacist by training. A little bit of my background, I grew up in a family of pharmacists, so my dad's a pharmacist, my brother's a pharmacist. We're all graduates of the Massachusetts College of Pharmacy. I graduated in 1984, came here to train as a pharmacy resident at Brigham and Women's Hospital, thought I would be here for a year, and 37 years later, I'm still here. And I can tell you my job has changed just about every 3 to 4 years, so I've always had something new here at the hospital and something to be engaged with. So that's my short biography, if you will. Andrew, you talked a little bit about the pandemic. What an exciting time to be in healthcare. And while you can point to the future, I would suggest the future is now. And nothing becomes more obvious than the introduction of the COVID virus a little over a year ago. And in the world of healthcare, here we have the introduction of an infectious disease that we know very little about in terms of management. So thrust into our hospital is a whole host of infected patients where we needed to manage them. At the same time, very quickly, new investigational drugs emerged that we didn't have, and we needed to study over a short time period. So we were faced with introducing new therapies as quickly as possible. How exciting is that? And then at the same time, as the virus raging across the country here, we introduced the series of vaccines to test in patients. So I think if I had a chance to tell you what the future of healthcare holds, I think we face the urgent situation with a COVID infection, but truly there are lots of other diseases that we are managing routinely, that we are trying to improve care. We are testing new drugs and new devices. And so the opportunities in healthcare really to prevent diseases and treat diseases is an endless activity, an endless job that's constantly changing. And how exciting is that? To be in a field where you are faced with the opportunities of introducing new therapies on a routine basis for different diseases. And the pharmacists, if you will, I think are at the cornerstone of many of these therapies.
John, that makes a lot of sense. And you had mentioned the pharmacist's role in everything that we've been facing, globally. And I think what's also really interesting is how pharmacists in general their view is changing in the United States. More states, including Massachusetts, are now recognizing pharmacists as healthcare providers. John, can you explain what that means and how this fits into the future of pharmacy?
Yeah, so I think, Andrew, one of the obvious recognitions now as healthcare changes. So many years ago, you counted on a physician coming to your house to care for you. Probably when my dad was a young child. Things have changed dramatically now, and the weight of patient care is no longer solely on the shoulders of a physician. There are multiple practitioners now, physician's assistants, nurse practitioners, nurses, pharmacists that all bring an expertise. And in my time here at the hospital, the physicians have recognized that the pharmacist is an important source for information and an important source to help care for patients and give them direction. We have set up collaborative practice agreements with our physicians, so our pharmacists are actually allowed to prescribe medications following or under the direction of a physician. So we create a disease state. There are very typical standards of practice surrounding medications, and rather than wasting a physician's time with the details of changing medications or changing doses, a pharmacist can easily recognize when a medication dose needs to be increased, when a dose of medication is no longer working, and a dose needs to be changed. So we can now practice under the umbrella of a physician, allow the physician to see more patients, but allow the pharmacist now to expand their role in helping patients manage chronic diseases. So we've started with diabetes, a chronic condition, and multiple different insulins. We've managed anticoagulation, typically in the setting of atrial fibrillation. There are a whole host of drugs that are needed in terms of rhythm control and rate control of the heart. So the pharmacist now can not only take care of the drugs, but they can help provide the patients with direction in terms of changes that are needed quickly, rather than waiting, say, for a physician's visit every 3 to 6 months. So that's what's emerged. We've now become an important part of the individual practice groups here, ranging from primary care to cardiology to transplant, is something as elaborate as organ transplantation, and help manage patients as they go along their course of care.
Wow, that's great. It really does sound like pharmacists are part of an integrative team, as you work with so many healthcare providers, in your everyday work. And one thing that I will mention is that if you are considering studying pharmacy, one thing that you should do is find a school that engages in interprofessional education. Interprofessional education is actually part of your education where healthcare practitioners from different backgrounds will collaborate, share their unique skill sets, and learn and consider the values of other healthcare workers. So similar to what John was saying, you're going to be doing this throughout your entire education. At MCPHS specifically, we immerse students in this from the very start of their academic career. Interprofessional education is a very big component of our labs, our classrooms, simulations, and even partnerships with local healthcare institutions. And these experiences encourage members of our community to share their own perspectives and then obviously understand others. So John, I know it's obviously very related to what we were just talking about, but can you talk about how something like interprofessional education is really going to help people that you see once they enter the real world?
Yeah, I think, Andrew, it's incredibly important. So first, I just want to say the college gives you a tremendous foundation to build off of. So you're not going to learn everything, even in your entire career, in a short period of time at the college. And hence the collaboration that you have with other disciplines becomes incredibly important in terms of your further education. I've worked alongside nurses in our critical care units, and they've taught me how to read an EKG, for example. I've worked alongside physicians and learned how to interpret laboratory tests and what the next steps are. All of this applied to medication therapies that we have available for managing patients. So, Andrew, I have to tell you, I think it's incredibly important that as this journey as a student goes forward, that you will be exposed to different practitioners. Obviously, pharmacists will help teach pharmacists, but there are wonderful opportunities now to engage other disciplines and learn from their experience and help you fortify the knowledge that you have surrounding drugs and to be able to apply that knowledge in terms of day-to-day clinical care. So I think the college puts the student, and many of the MCP students are here with me, alongside my pharmacist and alongside the practitioners. It immerses you in an environment where you'll be exposed to multiple disciplines and have an opportunity to work with those people firsthand. It's incredibly important.
That's great, John. And I think it goes without saying, but obviously we're talking about a wide range of career opportunities here for pharmacists. I mean, pharmacists can work in nuclear labs, veterinary clinics, government agencies where they're researching, helping with drug development, and how drugs interact with one another. I think community pharmacy, or as many people may know it, retail pharmacy, is undergoing change with expansion of year-round immunizations. And obviously this reorientation towards patient care, even in those traditional settings that we see pharmacists. So John, can you talk a little bit about just those various career options and why pharmacy in general is a really rewarding career?
Yeah. So Andrew, great segue. I mentioned my dad was a pharmacist. He was embedded in the community. And I have to say, he knew every patient that came into his store, and he saw himself as part of the fabric of the community. His role was as important as all the other physicians in the community to provide care for the neighborhood population. Today, I still think that role is incredibly important, but now the value of the pharmacist has been recognized in the hospital. So we never have enough pharmacists here to add to the different teams of practitioners that are caring for patients. There's a role for us in research, okay? I've had many of my pharmacists jump to industry, both in the setting of as early as drug development and like I mentioned, with antiviral therapies, to the end of the product development in terms of sales. So lots of opportunity with industry in terms of drugs and devices. There's a huge opportunity in the world of research. We are faced with enormous amounts of information coming from us in terms of patient care, now even magnified with the introduction of electronic health records. So not only is there an element of research in terms of drug development, but there is research in terms of finding out now how populations of patients are being managed and what their outcomes are of different therapies that we have to offer. And then finally, our expenditure in healthcare has grown dramatically. And so there is a huge interest on the side of the insurance companies, the payers. There's a huge interest in terms of government. There's a huge interest in terms of groups that are trying to assist in how we evaluate the effectiveness of drug therapies and their role in picking the ones that work best. And so I can't discount that there is a huge opportunity in the areas of public service that we desperately need experienced clinicians and pharmacists to actually help guide the choices that are made by regulatory agencies, by insurance companies, et cetera. So I have to paint you a picture, really, that there's opportunities everywhere for a pharmacist to be involved. And while someone like my dad in the community and myself here in the hospital can find a career of 30 plus years of opportunity and engagement, there are lots of opportunities outside of the traditional areas that people typically associate with pharmacy.
That's great. It sounds like there's going to be a lot of opportunities, as there's, I think, a shortage of people to fill these jobs. There's high placement rates for those who study at MCPHS, specifically in our pharmacy programs. We offer a direct entry 6-year program coming straight out of high school. We also offer a professional phase program if students wanted to complete that in 4 years. And then we also offer an accelerated program for students who've completed prerequisite courses and want to accelerate their time to their PharmD degree. Demand is only going to rise. By 2050, there's going to be more people 65 plus than children younger than 5, and they'll all need care. Also, there's an increase in the amount of prescriptions being filled and more drug availability. Hospitals are seeing an increase in emphasis on jobs. Numerous studies are showing and proving the presence of a pharmacist at a hospital reduces the number of medication errors and reduces costs. So there's a lot of opportunities for you in the future, and now is an absolutely wonderful time to consider a career in pharmacy and to start your path towards that goal. So as we wrap up, I just again want to say my name is Andrew Rosebank. I'm the Director of Admission of the School of Pharmacy at Massachusetts College of Pharmacy and Health Sciences. I'd love to talk to you further about your interests. But before we wrap up, I just want to turn it back to John and see if he has any final thoughts for us.
Yeah, thank you for including me, Andrew. Thank you to the college. The folks that are out there, the students, the family members, the moms and dads, healthcare is a fantastic industry. We are always looking for dedicated people. We are looking for people that are compassionate. We're looking for you to join us here in delivering care for the folks that need it. So it's a great time. It's a great time to be involved in healthcare. It's a great time to apply to the Massachusetts College of Pharmacy.
Excellent. And with that, we will end there. Thank you so much.